My name is Dr. Robin Ferguson, and I am the general dentist for the Dental Dream Team. I've been practicing dentistry now for at least 20 plus years. The reason why I chose to go into dentistry because it was very rewarding. It allowed me to work with my hands, something that I really enjoy, the kind of artsy side of me. And it also gave me a lot of satisfaction in helping patients to improve their life by changing their smiles, allowing them to be able to eat and function normally. The name speaks for itself. We are the Dental Dream Team, so we can cover many aspects of dentistry, from oral surgery to implant placement to gum disease, controlling it, various treatments for that, and also just really restoring a smile back to a healthy, beautiful state. So it's very important that all of those entities work together. Because I'm the quarterback, we kind of sit down as a group. We have our doctor's meeting and we sit down and we go completely over all of the treatment plans for any particular patient from the beginning to the end. Even though sometimes patients may not be able to get all of the treatment at once, at least we have an outline of where we're going and what our ultimate goal is. And so my role is to kind of make sure all of that happens, make sure that the patients are up to date with what's going on, where they're at with treatment.
My name is Jean. I was watching TV and I saw a commercial that was going over the different procedures that they have at the dental office. I decided, because these were treatments that I had in the past and I felt like I didn't get the best results, I wanted to see if this type of treatment would help at this time than the treatments that I had in the past. When I saw the commercial, she showed that there was another procedure that wasn't as invasive as the one that I refused to have again anyway. And so from there, I started looking on her website. Once I looked on the website, to kind of look around to see some of the other procedures that she offered, some of the services that she offered, I decided to call in because it said, they'll take a free consultation. And so that's how I ended up going to the location for a consultation to see if her procedure can help my situation or the situation for my teeth and things at this point.
Patients come in, I would say the majority of the patients come in with some level of fear or anxiety about coming to the dentist. There are a number of different things that may be causing that anxiety, whether it be a bad experience, whether it is just fear of the unknown. And I think what really helps a lot of patients is that time that we sit down and we treatment plan and we talk about these fears and we talk about what's going to happen. These steps are going to happen. Sometimes patients don't want to know. They just want to have the work done. We find that sedation works well for them, whether it be a general anesthesia or whether it just be a light conscious sedation. Those things work well for those patients. It goes back to that communication, talking to the patient, finding out what's going on with them and what their anxieties and what their fears are.
Went in for the consultation. Actually, it's a very nice place, so I really like the atmosphere. And when I went in for the consultation, basically I just, told the doctor a few things, and she knew exactly, so she did tell me that the treatment, more than just quarterly cleanings, I needed to do a little bit more. And so we set up an appointment for me to go back and really do the next examination.
It's very important for dentists to explain the different treatment options that people have available to them, whether they can provide that treatment or not. It's kind of a matter of informed consent. So we spend a lot of time giving patients choices, not trying to confuse them, but just letting them know that there's more than just one choice. Sometimes the choice isn't always clear, and we do make recommendations on what we think would be the best option. And sometimes patients want options that we're just not willing to do because we just know it's just not good dentistry. Giving patients choices, educating patients. A lot of my patients just don't know what's going on in their mouths. They have no idea about periodontal disease, and that complimentary consultation that I offer is just basically my service of informing people of what's going on. They may not be at a point where they can accept treatment at that time, but at least they understand that at some point in time, something needs to be done. So we do spend a lot of time educating people so that they're knowledgeable and understand what's going on. We're just not going to put some treatment on them and do something that they're not, we don't like patients walking out not knowing what just happened. And when patients come to me and I explain what periodontal disease is, and then they go, oh yeah, I had something done like that, but I never really knew I had a gum disease. Sometimes dentists explain things, but it doesn't always stick. So even my patients, I have to constantly repeat so that they eventually get it, because it's hard to grasp everything at that first appointment. So we're constantly reinforcing things here at the office.
Make us your wise choice. Choose the Dental Dream Team.
I don't want my smile or my teeth to make me pull back on what I'm passionate about doing. And that's something that, you know, will kind of take your confidence level down if you don't have the right smile or you feel self-conscious about how you look, or, you know, how your teeth or your mouth or your face look for that matter. So that's important to me as well. So it's worth investing in the money. I mean, we, you know, invest in all sorts of things, cars and, you know, trips, vacation, but sometimes just taking care of yourself, you know, makes, you know, the car look better, you know, even all the other items. But I think it's very important because it goes hand in hand with your confidence level, your personality, your environment. So it makes a difference, yes.
My name is Deborah, and I've been going to the Dental Dream Team since 2005. I found out about the Dental Dream Team because I got a postcard in the mail. I had some issues with my teeth and I'd gone to several dentists. What they were telling me really wasn't going to work. So I said, okay, I got this card, I'm gonna go and just see what they're saying. And I went in and I saw Dr. Ferguson. You know, she greeted me, welcomed me in. And she was the first dentist that I'd spoken with in it was over a 2-year period, who actually, what she told me the process would be made sense. You know, she was very honest with me. She told me, she said, look, these are the issues that you have, these are the conditions, and this is what it's going to take to fix it. We have a team of professionals here who can work with you. And I was very pleased with that.
The beauty in being here within the practice is that you have 3 separate providers that provide different care. So if you have a patient that comes in that needs to have gum treatment or an extraction, or I need to prepare a tooth for a crown, we can usually work together on that patient, sometimes on the same day, so that we're able to take care of that patient's treatment completely. Instead of having that patient to go across town and then come back to your office, it's right here within the office. And patients really appreciate the convenience of everything located kind of under one roof.
I've just been very fortunate in the whole process that I was, you know, connected to a team of professionals who actually worked well with me. And in terms of professionalism with their office, because I've been to dentists all over the place. I mean, because I was always trying to figure out how I'm going to fix this thing. I've been in offices where they were not friendly, where the offices were not always immaculate. One of the first things I noticed with theirs is the professionalism and the friendliness of their staff. I mean, I come in once every 6 months and everybody there knows me by my first name. It's really wonderful that people remember who you are. They ask about your family. You know, they really are concerned. So it really is one of the most professional dental offices that I have been in for decades.
Our staff has been with us for 20+ years, so we've been very blessed with being able to maintain and retain really talented staff that are very caring and professional. I call them my front line, and they really do take care of both the dentist and the patient. Answering the phone at a dental office can be quite challenging. So they really have honed their skills. They're extremely professional. They keep up with continuing education. They do all they can to help process your claims so you can get as much money as possible from your benefit. And they're very dedicated and caring people.
My gums had bled for years, and I thought that I was a gum bleeder. I thought that was just a natural part of what happened to me. After her working with me, my gums don't bleed anymore. And I'd had bleeding gums for decades.
I have this club called the Front Tooth Club, and she was a member. A lot of times people will ignore their dental health until something goes wrong with their front tooth. As soon as it shifts or gets loose, they make a beeline to the dental office. So I have a lot of people in the Front Tooth Club. So she came in, and that was her main concern. And so we were able to really pull together a comprehensive treatment plan. It included orthodontics, braces, surgery, restorative work, dental implants, the whole thing. She really got a comprehensive plan. She had everything done. She moved along with the treatment. She's beautiful. I mean, she looks fabulous, really. It's funny how time can go backwards. You always wonder, where's the fountain of youth? A lot of times it's when you get your smile back.
Make us your wise choice. Choose the Dental Dream Team.
The most important thing for patients to remember when they're seeking care, you don't want to ignore it, you want to address it. We have lots of different treatment options that we didn't have 5 years ago, 10 years ago, or 15 years ago. Now with Dr. Yetta McCollum using the laser, we're able to hold on to teeth that I would have said, forget it, take them out. But we're able to hold on to them for a longer period of time so that maybe we can stage out treatment so that a patient doesn't have to go around with all of their teeth out wearing a full upper denture. But we can stage it, take out a few, put implants in, let that heal, come back the following year and continue care. So you don't want to sit at home and just think about it and not act on it. You want to come into the office, see what needs to be done. That way you can make a more informed decision about how you proceed with your dental treatment.
My name is Robert, and I've been going there since January, I think it was, of 2012. My wife, she encouraged me to go. She was there first, and she encouraged me to go. And I was reluctant, but I went. I've had implants and caps. I went there with 2 broken teeth. I was kind of impressed with the work that they had done on those 2, so I just continued, and I have to take Dr. Ferguson's statement about she kind of replaced my smile.
My name is Cornell McCullum III, DDS MD. I am an oral and maxillofacial surgeon and a physician. A good candidate for a dental implant is someone who is already missing a tooth or multiple teeth or all of their teeth, or someone who sees that they may be losing a tooth because they need a root canal, or a root canal has failed, or for some other problem they may be losing a tooth, maybe from periodontal disease, a tooth is becoming loose. Those are good candidates for implants. The sooner that we see them, the better that the whole process can proceed, because if a person is going to lose a tooth, there's preparatory work that can be done to make things more smoothly later on. But if a person is already missing teeth, still, the sooner we see them, the better we can accomplish an ideal result.
Before I came to them, I had a dream that I had a perfect smile. And I woke up in the morning, I wrote down the dream, and I told her, I said, look, you've given me the fulfillment of my dream. I actually have that perfect smile that I dreamed about. And it was really just a wonderful thing when I had that epiphany. Wow, I'm there, and it really didn't take that long. And they really worked with me and explained everything.
I think the biggest thing about our practice is we can usually take care of everything. So whether you need to have a veneer, which is just a covering over the front of a tooth, whether you need a crown, which is a reduction of a natural tooth with full coverage over the tooth, whether we need to replace one or many teeth, whether it be with a partial, which is an appliance that comes in and out of your mouth, or whether we replace a missing tooth with a fixed bridge, which requires shaving the teeth down on either side of the space, or whether we go with something that's more conservative, more of the standard of care today, an implant to replace a missing tooth. Those are things that we can do to restore your smile. We put your smile back on your face. You know, we don't want to see anyone not smiling, so that's our specialty.
I didn't have any fear of going to the dentist. I had more concerns about what the cost would be, because I had so much wrong in my mouth. And basically, at the end of the day, I have to say that it was well worth what it cost to fix my smile. I remember I wouldn't smile. I mean, I had gotten to the point where I would cover my mouth. At the time, I worked with people who trained dentists, so they were dentists training dentists. And to be around people like that and your smile is crooked, you got teeth shifting and all of that, it was very, very embarrassing. So I always had my hand in front of my mouth I was always talking like this. And now I don't have to do that anymore. I can go anywhere, I can be in any situation, and I can smile, and people will say, "You have a beautiful smile," and I can say, "Thank you." You know, and it's because I showed up at that place with this postcard that I received in the mail from the Dental Dream Team, and it really was a dream come true.
I think the oral health is tremendously important to the overall health for a couple of reasons. From a health point of view, we definitely need water to live, we need to eat to live, and to be able to eat well, you need to chew. So if a person can't chew well, or they can't masticate and grind their food well to chew, then they're not swallowing well chewed food, which means their intestinal system needs to work extra hard to make this food into smaller particles so nutrients can be absorbed. From another point of view, self-esteem is very important. For people to smile. Some patients are looking for jobs now. They're trying to interview for jobs, and if a person has a nice smile and a person doesn't have such a great smile, usually the person with the nicer smile isn't going to get at least considered or hired. So it's important from that point of view.
My name is Mary. I have been going to the Dream Team for about 4 years. I think I just lucked up on them, and it has been a very, very fortunate experience for me. My teeth have been crummy for my past life, and I was very uncomfortable, and I didn't like to smile, but they made life better for me. That's what they were trained to do, save teeth. But many of mine could not be saved, and many things had to be redone. And right now I have full mouth reconstruction. I have implants, and I'm very satisfied, and I feel confident. I like to smile now.
Mary had dental implants on the upper and lower jaws. She had what we call the all-on-4 procedure, which is basically almost all your upper teeth supported by 4 implants. So it's similar to a denture, but it's kind of a modified denture, so a combination between what we call a denture and a bridge. The teeth don't come in and out of her mouth. They do stay in permanently, but the dentist can remove the teeth maybe twice a year, just maintain the hygiene and check and make sure she's providing good hygiene at home.
Everything you see is the reconstruction or the implants. And I've had this now about, I would say 2 years. And I go back for maintenance, and I try to do everything they say do to keep these teeth the way they put them in. And I'm very satisfied.
I think initially she did have a few teeth when she came in, and she had partial dentures, but the teeth that she had weren't great teeth to save or to work with, so we decided to extract them. It was just a few teeth also. What we did on her was not teeth in a day, it was just kind of a modified version. We didn't want to rush the process. So we did the implants, we let them heal. She had a temporary denture during that time. And then after 4 months, we proceeded with the permanent denture. So that was one of our early cases, turned out very well.
It really makes our work so satisfying when we know that we've helped someone be more successful in life. And a lot of times getting your smile back and getting your oral health back can do that. I've had patients come to me after getting the periodontal infection cleared up, and they just look better. They just feel better throughout their whole body. I mean, when you think about that type of care and being able to be part of that, it really is a very fulfilling profession. I really do enjoy what I do very much.
My name is Michelle, and I've been going there approximately 13 years. I go every 3 months for cleanings, but I've had a period surgery. It's an ongoing procedure, you know, of course, when you have periodontitis. And I go for the health of my gums. And when I had that procedure, it saved my teeth because I had a little problem with the molars, and they're stable now. I don't have any problems, and it looks like I'm going to keep them for a while.
I think the biggest step for a patient when they're seeking dental care is just to make that initial step into the office. So my philosophy is, why put off what you can do today for tomorrow? You should come in, get familiar with the office, you know, walk around the office, meet everyone, get comfortable with everyone, have a conversation with the dentist. Not necessarily start treatment that day, but at least come in and see what's going on. A lot of times we will do consults for patients first and then schedule them accordingly as to what they need. Most of the time, patients will start with me with a full set of x-rays, and then they'll see Dr. Yetter for their gum treatment. And sometimes, because the gum treatment is so out of control, prior to me restoring their mouth, they really need to have gum treatment first. And that's where Dr. Yetter will take care of everything. So many things I couldn't do without the two of them, because they basically give the foundation so that I'm able to put anything on top of that foundation, whether it be a veneer, a crown, a bridge, an implant crown. I need those two to help me to give that foundation for that patient.
As a little girl, I remember my grandmother putting her teeth in a jar, you know, in a glass. And that is something, when I found that you don't have to lose your teeth, that was very, very important to me. And I learned that going to the Dream Team, if you put your money into what's important to you, that is what's important to me. After I had the perio surgery, I go for my 3 months maintenance. And you know, you go for your checkup yearly, but Dr. McCullum is very good every 6 months or so, or whenever you have problems, because my hygienist will let her know if I have problems. My teeth are stable now, and that is so important to me, to be able to keep them, you know, chewing on, you know, just eating and things like that. It's really important to me to keep my teeth.
I do offer complimentary consultations for patients that are interested in dental care. For the LANAP procedure, laser-assisted new attachment procedure. The great thing about this is it can be done more quickly than the previous way I used to treat gum disease. A lot of people are familiar with that deep cleaning, that scaling and root planing procedure, and then you would come back for a surgical procedure, and sometimes that scaling and root planing procedure is done over 2 to 4 visits, and then you come back for another series of visits with the surgery. Now it's all combined into one visit, 1 to 2 visits. This LANAP protocol can be completed. And it's great because it works best on untreated gum disease. So you don't have to go through that initial scaling and root planing. That's done when you have the LANAP procedure done. So it really shortens your time in treatment. From an expense standpoint, yes, there is an expense associated with it, but to be honest, I don't charge as much as my scaling plus my surgery. So the expense is manageable. We do what we can to help you with financial arrangements, to make your payments out over time.
Before a person embarks on this path, they should come up with a budget, because that lets me know where to start to come up with a plan. That's the way I approach patients now. When we first see them for consults, we say, ask, what is your budget, so we know what we're working with, and then come up with maybe 2 or 3 options and then let a person decide what's best for them.
A large percentage of the population suffers from some form of gum disease, but only a small percentage actually follows through with treatment. There's a lot of obstacles to care. I think one of the main ones is periodontal disease really doesn't cause pain. It can be easily unnoticed or just taken for granted, like, well, my gums bleed a little, not a problem, I can rinse with this, or I can brush a little more, or use some new product, and it might make a difference for a short period of time. What unfortunately can happen with time, though, is that you can go from the early stage of periodontal disease, which is known as gingivitis, and when you hear the commercials and you're buying products over the counter, they're really geared to help people combat gingivitis. And a large percentage of the population has gingivitis. But then there's another segment of the population that actually begins to have the loss of bone support. And when that happens, it's only through a periodontal examination by a dentist or dental hygienist that you'll know if you indeed have that periodontitis.
I have had people to ask questions like, well, where do you go to get your teeth done? You know, I need braces, or I says, well, you know, I tell them where I go. I go to the Dream Team, but I'm an advocate of healthy teeth, you know, and Dr. Yetta McCullum will drill that in you too. I tell them it's about the health of your teeth first. Before you try and go get braces and do anything, you've got to make sure that your base is supported. That is the gum tissue and the bone structure. My whole thing is about the care of the teeth, and when I recommend family and friends and stuff there, I pray that they would not be turned away because maybe certain things may be a little pricey to them. But I say you put your money where your mouth is, because you'll see some people, they like big houses or nice expensive cars, and to put that little bit of money in your mouth is worth it.
Is it important to put your money where your mouth is? Absolutely. Because your mouth provides you with so many things. It provides you with a smile. It provides you happiness when you smile. It provides you with the ability to chew, to eat, to not be embarrassed. And so I think if you talk to a lot of people and their mouths are not where they'd like it to be, that is something that they focus in on. And they're like, oh, I just wish I could smile. You know, I would just feel so much better if I could smile. And a lot of people don't realize how much health-wise that your mouth affects you if it's unhealthy.
Make us your wise choice. Choose the Dental Dream Team.